Politics, business, entertainment, here face to face.
Good day, ladies and gentlemen. I want to warmly welcome us today again on Face to Face podcast. Today we have a very vibrant young doctor, Dr. Sam Chukwuemeka Onunkaji. Doc, you're welcome, sir.
Thank you very much, sir.
You may wish to introduce yourself.
Okay, as you've rightly said, I'm Dr. Sam Chukwuemeka Onunkaji from the Department of Obstetrics and Gynaecology, Abia State University Teaching Hospital, and also an Assistant Medical Director to the Simeon Specialist Hospital here in Abia. Thank you, sir.
You're highly welcome.
Thank you.
On Face to Face podcast.
Okay.
Today, Doc will be doing justice to the topic dangers of taking unprescribed sex enhancement pills, also known as aphrodisiacs. So, Doc, can you let us know what are aphrodisiacs?
Okay, aphrodisiacs are gotten from a Greek word, Aphrodite, and that's the name of the ancient goddess in Greek. So, aphrodisiacs are very simple sex enhancement pills that are being taken by people to enhance, either to stimulate or enhance sexual performance.
Okay. All right. So, on the other hand, what is sex enhancement medication?
Okay. These are medications formulated from our natural fruits and vegetables, purposely for enhancement or stimulation of sexual desires. And these drugs are usually prescribed for patients with this medical condition. Number one is low libido. When a man has low sex drive, he can no longer start a sexual intercourse. That's when we prescribe it. Number two is reduced erectile confidence. To people who do no longer achieve strong erection, these are people whom we prescribe these drugs for. And in bracket, we'll make a diagnosis of erectile dysfunction before we prescribe these medications. Thank you.
Okay. All right. Tell us more about the abuse of these aphrodisiacs.
Aphrodisiacs are abused everywhere now, mainly in Nigeria. Everybody wants to last 2 hours, 3 hours during sex. Everybody wants to perform after performance, expecting a cup, but not considering the dangers of these sex enhancement pills. Know that what these drugs do is they increase blood flow to our peripheral organs. They also do that by increasing blood flow to our genital organs, to the penis, thereby sustaining erection. What happens in erection is blood flows there and stay there.
Okay. Okay. So ordinarily, how long should a healthy man last on bed?
There is no specific time for any man to last in bed. There are factors that will determine how many minutes, hours, or days or weeks you should last in bed.
Or whether the person wants to die there.
Okay. These factors are, number one, hormonal.
Okay.
Number two, factors are emotional.
Okay.
Number three, could be environmental factors.
Yeah.
So these factors I just mentioned now depends on how you last. You don't expect a man having sex in an unprotected building to last for 3 hours. Okay. When his eyes is looking everywhere, looking at who is coming and everything. Yeah. So these are factors, and this thing. Okay, research has shown that a man should last within the minimum of 5 to 7 minutes each intercourse.
Okay.
So anything beyond this, there are people that have this God's given gift of lasting very long, and there are people God has given gift of lasting for 5 minutes. So looking for agents, concussion, whatever you would take to elongate your lasting period without considering your health background is an abuse to these sex enhancement medications. We all know that each and every one of us in one way or the other must have taken these sex enhancement pills. Most of them have side effects, like after taking it, you start having blood visions, you start having palpitations, your heart starts beating very fast, you start getting weak, catarrh, with a lot of nasal congestions. So these are side effects which a doctor should put in place before giving you any of these drugs. Because if you're having, if you're a non-hypertensive patient, you shouldn't be taking these drugs. Lowering your BP can trigger heart attacks, can also trigger strokes. We all have seen cases of where a man died in this hotel, a man died there, a man died there. Is in the course of not considering the basic health challenges you're having and you're taking these drugs. For example, any man taking a heart medication called nitrate shouldn't go close to these sex enhancement pills. But they have a way of interacting and causing heart attack.
Of course, I know that there is no cup designed for the long-lasting man, or the man that has lasted the longest on sex so far. So I want to ask, why do people want to, have it so long? Why?
People want to achieve long intercourse because of so many societal factors that are not real. Everybody is now hearing 2 minutes man, 2 minutes man, 2 minutes. Nobody wants to be categorized among the 2 minutes men. Everybody wants to improve sexual performance and sexual pleasure. Every girl's expectation has been raised against 2 minutes and 3 minutes. So this is mainly among our youths. Everybody now patronizes people, and the problem is that normally, if you go through the normal regulated sex enhancement pills, they all have the quantity of this plant extracts deposited in them for this particular purpose. But other unverified companies go mix them, concoct everything,
just extract them and
put everything, so that's what our men want. People go and patronize them, take it for anything. That is why we have high incidences of kidney failures, heart failures. You now see a man of 20, 30 with swollen feet. Everywhere is swollen. Everything going bad. And the society will come up with, we should contribute money for the person without knowing that person's medical histories. So my advice is very simple. If you need to take these drugs, I think you should visit your doctor. For a doctor.
Okay, let me just ask. Who is safe to take these aphrodisiacs?
Whosoever a doctor has evaluated and prescribed these medications for, is safe to take them.
You mean on one's own? One should not just opt to take aphrodisiacs when he has not visited a medical doctor?
That is quackery.
Oh.
That is self-practice. It's just like I'm in this studio now. I feel like this light is not shining very well. I don't know anything about the light. I go to turn it upside down. So these medications are fashioned for a particular purpose. These medications are fashioned for people under this category I'm going to mention. Number one is aging people who could no longer achieve sexual erection. Number two, people with low libido. Number three are people who are fine but have a purpose for a lasting long. You just have these people acting these nude films and everybody. they on these medications are being prescribed by medical doctors for a particular purpose.
Yeah.
So our people go emulate them.
Because that is their business.
Yes,
now.
yes.
They are taking it for business purposes.
Yes.
And under the guidance of a doctor.
Of a doctor.
Yeah.
And after that particular purpose, if you are having erectile dysfunction, like you notice your penis is no longer standing up the way it does before now,
Yeah.
you can approach a doctor. And we could give these medications within a period of time it will be corrected. And we'll take you off the medications.
Okay.
Because long use has its own effect, which we'll also come to discuss.
Okay, but are there some benefits? Okay, I know you've highlighted, but I wanted to talk more on the benefits of taking these sex enhancement pills.
Number one, everything that has a disadvantage has a benefit.
No.
One of the benefits of taking this this medication is it gives you an elongated sexual pleasure.
Okay.
Number one. Number two, it creates intimacy between couples.
Yeah.
It creates a very good intimacy.
Some people do say that good sex, keeps marriage. Is that true?
It does, because for us, for women, if we are being starved of sex,
Yeah.
if we are being starved of ejaculation over a long time, it affects our mental health.
Okay. Although I was coming to that anyway.
Okay, when both of us are satisfied, everybody is happy and everything is going well.
That's good.
So another thing it does is also, I mentioned about sexual pleasure, enjoying good sexual pleasure. I've also mentioned about it gives intimacy to partners.
Yeah.
Another thing it does, it also boosts the ego of a man.
Okay.
Satisfaction. I'm a man.
Oh no.
It does that.
Yes, that's
So these are the few benefits. I would think that these benefits should come under after medical evaluations.
okay.
You shouldn't take these benefits above your health status.
Okay. I know that so many people today are addicted with these aphrodisiacs. How can someone come out of it?
Number one of the major side effects of aphrodisiacs are, number one, is what we call psychological dependence.
Okay.
When psychologically you are now dependent on the drug to perform,
Yeah.
you now feel that without this drug, you can no longer perform as a man.
Okay.
When your hormones have always received a top up of this
Signal.
Yes.
Top up signal of these.
of these medications.
Yeah.
Now you feel you can no longer perform without these medications. That's one of the dangers.
And the body will condition itself.
Itself, the body now needs stimulation from these medications to act normally, what it should act on its own. So this is one of the dangers. What we'll now do is, there's what we call withdrawal syndrome.
Okay.
If you want to withdraw yourself from it, withdrawal syndromes will set in. Depression.
Yeah.
You now go perform, within 2 minutes you're out. The next 2 minutes you're out. You can no longer, the lady you've impressed for years with these drugs, that have known you as a 3-4 hours man, now see you coming within 2-3 minutes.
Yeah.
So these things can lead to depression. They can lead to anything.
All right.
Now what we'll now do is, we don't withdraw the drugs immediately.
Okay.
We'll start giving you intermittently to tell the body we are withdrawing this thing, to bring back those mechanisms that were lost
in the body.
Yeah. Gradually we'll start, if you take 2 daily, we'll start giving you 1. Let your body drop to 1 first.
And this is aimed at balancing the man's normal performance. And the effect of the drug. Okay.
Exaggerated effects of the drugs. What we'll now do is we'll drop you from one every 2 days.
Okay.
From 1 every 2 days, we'll drop you from 1 every 3 days.
Yeah.
That's what we'll now do until your hormones balances now comes back to normals.
Okay.
That's what we now do. So everybody that have gotten addicted to this drug, the best thing to do is to approach a medical doctor. You cannot do it alone, and you cannot do it with internet.
Okay.
A doctor need to counsel you. A doctor need to school you on what you're going to, where you're heading to,
and place you on therapy.
and place you on therapy.
Okay.
So you can be successfully withdrawn from that addiction.
Okay. So how long should a normal man, have sex?
How often?
How often?
There's this research that says that men between 18 and 24 years of age have sex, and women between 24 and 28 years of age have sex at least once every week.
Okay. At least
once every week.
At most.
At most. I don't know, at most. At least. What we'll say is everybody's body build-up is different.
Okay.
The rate at which you desire for sex is different from
you.
Yes, it's different from mine. Some people want sex 4 times every day. Some want once every day. Some want 16 times in a week, while some also want once in a week.
As a result of the lipido composition,
All fingers are not equal.
Yeah.
God also created everybody differently.
Okay.
So there is no stipulated time or amount of this everybody should have in a week. Go according to your strength.
But ordinarily.
And also know that there are factors that affect sexual drive.
Okay.
You don't expect a man who is busy from morning till night come back home
very late in
the night in a traffic, leave very early to be
without rest,
to have sex throughout the night. Sex is one of the factors that depresses sexual desire. Now, person wey get rest, they have sex.
I get that.
You cannot be sleepy and be wanting to have sex. Another thing is this economy is also pressing on people's libido. You cannot be thinking of your house rent have expired and you're thinking of sex.
You're thinking of the next
hungry man do not last a
your
bed.
children's school fees and everything. You're thinking of almost 20 things that are going on in your mind at the same time.
And you want sex.
And the woman is dragging you.
No, it cannot work.
It not work like that.
Sex is a product of relaxed mind.
Okay.
Okay. That is why you cannot see people having roadside sex for 3 hours. You cannot see people having sex in the bush for 4 hours. You cannot see people having sex in the uncompleted building for 4 hours. So there are factors that determines how a man goes after sex. These factors are: number 1, I've told you, stress is one of them. Number 2 is economy. There is what we call mental stress. You are not working, you are lying down, but you are mentally stressed.
So there must be mental stability for someone to think of
for sex too. That is why a man could be erected here now and hears a sound of gun. Within the next few minutes, penis is flat. So for a good sex to be actualized, there has to be stress-free mind. There has to be what I will call a good conducive environment for a stress life to thrive.
That's good. Okay, but are there some dangers of not having sex at all? No.
There is none. There is none.
So whoever chooses to abstain completely should go ahead.
Can go ahead and abstain.
Okay.
People would ask, our topic is dangers of taking unprescribed and sex enhancement pills. We've only mentioned few. Along the line, we have kidney issues associated with long-term use of aphrodisiacs.
Yeah.
Because all these drugs you take, the liver breaks them down,
Yeah.
but the kidney takes them out of the body.
Okay.
So when the kidney is a waste, like the kidney excretes the waste product from the
Yeah.
body. So they stay in the
It's the
kidney.
West Channel.
Is a waste channel.
Yeah.
And most of the waste channels, if you go to a company, most of the waste channels are not neat.
At all. Not at all.
Not at all. Because everything bad goes out from them. And thereby taking out a criminal, the criminal can harm you. And thereby trying to arrest the criminal can injure you. Run, you start pursuing, fall and everything. That's where the whole thing falls.
So these two organs, the liver and the kidney,
the kidney
suffers
most.
Okay.
Because once you take it, the next place is the liver.
Yeah.
The liver breaks them down.
Yeah.
Take the good components into the bloodstream. Then the waste goes to the kidney for excretion. Another factor that is very bad is, I've talked about the psychological dependent.
Yeah.
When you are psychologically dependent on that drug.
Yeah.
Without that drug, you can no longer perform.
Yes.
Kidney failure. Another thing you can also encounter is when your body now gets resistant to that medication. The body is always an Oliver Twist. You take this one today, it works.
Always craving for more.
Always craving for more. Always want you to add another dosage. When that one tablet you take that carries you within 2 hours can no longer carry you, you want to add more. Over a long time, you get addicted and the drug gets part of your sexual life. You can no longer do anything without that drug. That is what is leading our young youth to most of these abuse of alcohol, abuse of narcotics, like tramadol and all these things. People has even gotten to the extent that there's a drug we call lidocaine.
Okay.
Its function, it reduces the innervation of a particular organ. It's the same drug that if you have a cut now, we'll give you that injection. Give you that injection, you no longer feel pain. We stitch it.
Within that.
Yes,
Okay, yeah.
yes, we stitch it. Some people have gotten to using the cream, rubbing on themselves so they can no longer have feelings.
10 minutes.
Yes.
No, come again. Like
using lidocaine gel. Yes, using
by
lidocaine.
men or women.
Men using lidocaine gel, rubbing on themselves, enormous sensations. So you can no longer come.
10 minutes.
You can no longer ejaculate us. It will until how many
Whenever,
hours?
yeah.
On how many hours? That's until the effect wins out.
Just to answer a champion, or
Just to
for,
answer.
does it pay? How much can that's at the end of the day? How much can that person make out of that practice?
Another thing we should understand is that the ego of a man is priceless. A man can do anything to protect his ego. That is why a man can tell a fellow man, you cannot do anything, and the other person can go to any length
to make sure he does something.
to make sure that you cannot. You said I can't do anything. To make sure that, to see that I can actually do something. The ego of a man is priceless. There is no price, but just to fulfill the ego. Over time, these drugs will always land you to erectile dysfunction. You can no longer perform as a man. It will now be doing like Abba power. Light today, tomorrow there's no light.
Well, I don't want to go there.
Okay, let's not go. But for some time now they've been consistent.
No, that's why.
For some time now they've been consistent. So they'll be very, very consistent.
All right. Okay, but please, what's your last advice for especially our young people, against the use of aphrodisiacs?
My sincere advice to our young people using these medications are seek the help of a medical doctor.
Okay.
You need to be evaluated to check whether these medications are good for you. Number one. Number two, the earlier you stop, the better for you. The earlier you stop, the better for you. There's one proverb that I saw on the internet. I think it was said by Pet Edochie, that no matter the anger of a penis, it cannot destroy the vagina.
Okay.
The vagina is a merciful organ.
Other put it differently. No matter how strong the penis gets, it cannot pull down the wall.
It cannot pull down the wall of a vagina.
Yeah.
The vagina is there. Do everything today, tomorrow is still there. One thing we need to understand is women are sensitively created. The same man they give you today, they give another man tomorrow. The same praises they give you today, they give.
Or even more. They give it to another man.
If you are taking these drugs to last, to impress a woman, and in the process you die, know that that woman is not going to celebrate for life. So whatever you are doing, put your health first.
Yeah.
Now man where their life, they last.
Thank you so very much, viewers. Here is Dr. Sam Chukwuemeka Onunkaji, a very young doctor at that, doing very great work. I know he will appear on this platform once again to talk about certain, practices he's doing. There is a whole lot of things he's doing which we may not be able to discuss on this particular episode. So we are glad to have you here, Doc. I'll be glad to see you some other time. You're welcome.
Thank you, sir.
Politics, business, entertainment.